So in this video, we're going to be doing a quick overview of what we call our stoplight method at Limitless Concierge Physical Therapy when we're talking with our weightlifting clients in order to make sure they have a good idea of when to push through a little bit of discomfort or pain when recovering from a pain or injury and getting back into either rehabbing that injury or eventually back into the gym to do their desired lifts. So the easiest way I've been able to find to have this stick with our clients is to again talk through the stoplight method, which in terms of that green on the stoplight, as you can see on the scale down below, we consider anything from a 0 to a 3 on that 0 to 10 pain scale, with 0 being no pain at all and 10 being essentially you're being mauled by a bear or the worst pain imaginable. If we can keep our pain level between the 0 and 3, so that would be 0, 1 out of 10, 2 out of 10, 3 out of 10 pain, then that's perfectly okay. We're going to be able to work through that with our rehab exercises or our lifts. Now, if that pain level starts to push up into more of a 4 or a 5 or a 6 out of 10, then we're going to have our clients start to consider making a modification to either one or more of the variables that we have listed down below here on this handout. So we're going to be considering things like changing the overall range of motion, looking at how much rest time they have in between sets, how frequently are they performing these exercises, how much weight are they utilizing, or even things like how quickly are they moving the weight, and what position is the rest of their body in while they're doing those things. So, and again, with the stoplight method, this is going to be more of a yellow light in terms of us being cautious, starting to kind of slow down and consider what some of the other factors could be that are contributing to this pain with that particular exercise and making a modification accordingly, upon which then we're going to reassess and see what our effect was on that pain level. So, and then finally, with that red on our stoplight, that's really going to give us pause for concern, making sure that we are really reassessing whether or not we should be doing that level of that exercise, or we're going to be looking at multiple variables down below here, again, in terms of how much weight we're using, how quickly we're moving that weight, what position our body is in when we're doing that. And this is really a great time that we want to talk directly with our clients if they are experiencing a 7, an 8, a 9, or a 10 out of 10 pain, and making sure that we can intervene so that they stay on a really good trajectory or road towards recovery without having any setbacks along the way. So again, our stoplight method, when we're performing a particular exercise in rehab and getting back into weightlifting, our green is going to be our 0 to 3 out of 10 pain while performing an exercise. Our yellow is going to give us a little bit of pause for concern. We're going to make sure that we're modifying one or more of the variables listed down below. And then our red is going to be really giving us a pause for concern, make sure that we're stopping that particular exercise, that we're going to be talking with our physical therapist or rehab professional, so that we can identify why that is such a problem for you, and then either change our exercise or change multiple of the variables down below. And then finally, we always want to have our clients keep in mind what their response is following all of their rehab exercises as a whole. So even if those exercises aren't necessarily bothering them while they're performing them, if they have an onset of pain that is above 4, 5, 6 or higher out of 10, and that pain lasts for more than 24 hours after they exercise for that particular day, then we're going to go back again and change some of the variables listed on our stoplight method program here as well. And then we're going to go ahead and reevaluate the next time that they perform their rehab movements.